Welcome back. In this video, we'll talk about all the different types of antiepileptic medications. Antiepileptic medications are prophylactic treatment for seizures. To make it easier to memorize, I have categorized them based on the mechanism of action. The first are the calcium channel blockers, such as ethosuximide, which is the first-line treatment for silent seizures. It mainly works by blocking calcium channels in the thalamus. Like most antiepileptic medications, it causes vague symptoms in the GI such as disturbances and bloating, headache, fatigue, and some skin syndromes such as urticaria or Stevens-Johnson syndrome. These side effects are present in almost all antiepileptic medications. There are some antiepileptic medications with very distinct side effects. Those are the ones that can be mentioned in the exam, and not the vague symptoms like this one. We'll come to those in a second. Gabapentin is another calcium channel blocker, and it's basically a GABA analog. It causes sedation, headaches, GI disturbances, and sometimes it causes ataxia. Now the indication is very important. Besides being an antiepileptic medication, it's also used for peripheral neuropathy and post-herpetic neuralgia. The second category are the sodium channel blockers. We have phenytoin. This medication is very commonly used in neurology and neurosurgery. It is very effective. Now the side effects for this medication are very important to memorize. You will see them in the exam and in the clinical practice. It can cause peripheral neuropathy, hysterism and gingival hyperplasia. It can have a high chance of causing Stevens-Johnson syndrome, Dress syndrome, osteopenia, SLE-like reaction, megaloblastic anemia, Huntington syndrome, and it can induce cytochrome P450. It does have quite a number of side effects, but that's only true because the medication is so effective. Remember that medications are only toxins, but with the right dose. The other sodium channel blocker we have is the carbamazepine, and this is the first line in treating trigeminal neuralgia. The side effects include agranulocytosis, which is very important to memorize, aplastic anemia, liver toxicity, Stevens-Johnson syndrome, syndrome of inappropriate ADH, and the induction of cytochrome P450. The third and final sodium channel blocker is lamotrigine. It blocks sodium channels and prevents the release of glutamate. The medication can cause Stevens-Johnson syndrome only if it was withdrawn rapidly. So unlike other medications which can cause Stevens-Johnson syndrome with the use, this medication causes it with the disuse. So you have to taper it very slowly. The third classification we have are medications that work as or on GABA receptors. Of course, this includes benzodiazepines and barbiturates. They both act on GABA receptor by increasing the opening frequency and duration respectively. They cause the very known side effects of sedation, respiratory and cardiac depression, dependence. The thing to note is that eclampsia is mainly treated by benzodiazepine, and newborns and infants are mainly treated for seizures by barbiturates. Next we have vigabatrin, and they work by irreversibly inhibiting GABA transaminase. It can, in very rare circumstances, cause irreversible blindness. And we also have tiagabine, which increases GABA by inhibiting the reuptake. The next category are medications that can inhibit sodium channels but also increase GABA levels. So it has two actions, and we only have two medications. Valproic acid. This medication can also be used for bipolar and as migraine prophylaxis, on top of being an antiepileptic medication. The important side effects include alopecia, which is very important, liver damage, pancreatitis, inhibition of cytochrome P450, obesity, and tremors. The other medication with dual effect is topiramate. And just like its brother valproic acid, it's also used as migraine prophylaxis. The important side effects include slow cognition, kidney stones, weight loss, unlike valproic acid, and difficulty speaking. And finally, we have a medication that is very commonly used, but until recently we were not sure of the mechanism of action. And now we do kind of have an idea. And the medication is Levetiracetam. We think that the medication increases GABA and alters calcium channels in some way. The medication is extremely powerful and very effective. It's also very commonly used. The important side effects include psychiatric symptoms, such as personality change. And those are all the antiepileptic medications. Alright guys, that's all I have. Hopefully I made this easier for you, and thank you so much for watching.